Members of the National Assembly on June 29, 2022, during a plenary sitting, adopted the bill relating to medically assisted reproduction in Cameroon. But then, what is it all about? That's what we are going to be talking about after this short break. Welcome back. With me in the studio is Dr. Jacques Tingang Kamgang. He is a gynecologist and obstetrician. He's equally a specialist on assisted medical procreation. Good day, doctor. It is a pleasure having you on the program.
Thank you, Immaculate. I wish to greet all the numerous auditors and televiewers of Equinoxe TV all over the world.
So tell us, what is IVF?
IVF, maybe that is very focused. I would say assisted medical procreation in general is a number of techniques that permit couples who are unable to procreate, to conceive spontaneously, naturally, to manipulate the egg or the semen of the human being in the lab to permit them to get pregnancy. You can have simple stimulation of the ovary. You can have insemination by the sperm of the man or of the donor. You can have really IVF, and now with the progression, we can have ICSI, that is intracytoplasmic sperm injection. So to come back to the definition of IVF, in vitro fertilization, that is fertilization out of the natural cavity of the human being. Because normally, in normal time, the fertilization occur in the womb, in the tubes. Okay, can you see my picture? This is the womb. And normally, the fertilization occurs at the after 5 days. You come and implant in the womb.
Okay.
So the IVF consists to organize this encounter outside the human being in the lab, that is in the tube glass, to put together the egg of the woman with the semen of the man to fertilize. And after 3 to 5 days, we have to reimplant in the woman's uterus. The baby does not grow in the lab.
Okay. So now tell us, can any gynecologist carry out this procedure?
Can any gynecologist? Not really. You must be a specialist, but you must have done a subspecialization, must have been acquainted to the system, because normally in normal specialization you don't have the detail of the technique of assisted medical procreation like IVF. You must have worked with a center like 2 years to be able to acquire the technique, the protocol. It's not only the stimulation, you must be able to do the stimulation, to carry out the monitoring of the stimulation ovaries. You must be able to do the transfer of the embryo correctly. You must know the step in the lab. All is the whole technique, and it's a whole learning procedure.
Okay. So now, when is the right time for a woman to consider for IVF?
When she's not a woman, it's a couple.
Okay,
we
couple.
talk about a couple.
Okay.
It's because in Africa, it's the woman that carries the baby, and they talk about the woman, the poor woman, and it's the couple. And you want me to talk about maybe the cause of the infertility. Infertility is the inability of a couple to conceive naturally after adequate exposure to pregnancy for about 1 year. Adequate exposure is at least 3 sexual intercourse per week for about 1 year, And when it's not possible to conceive, then you can check and see where the problem lie, and what are the indication of the IVF. It can be female indication or male indication. Most of the time in our country, we have tubal obstruction, where I showed previously, where the fertilization occur. The tubes may be blocked, therefore there's no possibility of fertilization inside the body. It might be the tubes, it might be severe disease like endometriosis, it might be male factors like poor quality of the semen, poor mobility, erectile dysfunction in men, and also ejaculation, retrograde ejaculation. There are many causes, and also in some cases of unexplained infertility. That is, we have checked the man, you check the woman, you see the woman has no problem, the man has no problem. In that case, you can also propose IVF to the couple.
So now, tell us the step-by-step procedures taken when it comes to IVF.
The step-by-step, I don't know if the camera can show you, but when you have decided to do IVF, the couple, you must have carried out analysis in the lab for the man, for the woman, and therefore you make them sign a consent form that they accept the procedure of IVF. Now, when they are ready, what do we do? You have this can show the cycle. You have ovarian stimulation. The woman ready for IVF have take injection like every day, injection for every day to stimulate the ovaries. The injection goes to the ovary to stimulate the follicle to grow. It takes like 10 to 14 days. After, you have to retrieve the egg. You have to put the woman to sleep under general anesthesia, send a sound in the vagina to be able to, with the needle, to retrieve the fluid in which they are egg. And in the lab, the biologist therefore is going to put the egg and the spermatozoa together. That is the lab situation. This is classical IVF.
Okay.
I've written here ICSI. ICSI is a new approach of
IVF.
Further technique. ICSI, that is intracytoplasmic injection. In some case where the quality of the semen of the man is so poor, you have to line up the oocyte, work the spermatozoa, and do the micro injection. Put the spermatozoa directly inside the egg of the woman. That is ICSI in the lab. Therefore, then when this fertilization have occurred in the lab, then you can do the culture, embryo culture. It takes like 3 to 5 days in the lab. After 3 days, usually we transfer on third or on the 5th day, and it has been shown that on the 5th day, the embryo of 5th day is able to implant better than that of the 2nd or the 3rd day. And after the culture, you transfer to the woman womb, and 14 days, you do the pregnancy test, and in most cases, 35% of cases, the woman can be pregnant.
Okay.
So it works in one third. So when one couple is happy, 2 couples are crying.
Oh la la.
Yes.
Okay, so are there any restrictions while undergoing IVF?
Any restriction to undergo IVF? Yes, within the law, if the woman, the law has been very clear. The law number 2022/014 of the 14 July 2022 on assisted medical procreation in Cameroon, signed by the President of the Republic, stated well the age, their condition, and the woman should be at least 21 years, and or maximum 55 years, and the man too should be at least 21 years. There's no limits for the other one. The couple, the woman must have undergone consultation. They make the indication, proper diagnosis, and the indication of IVF. You don't just say, okay, come and say, okay, I want to do IVF. They go in. They must have woke up the couple and see that, okay, they are ready for, and they should give their consent. If they don't give the consent, if one of the couple don't give the consent to undergo the IVF, okay, we cannot proceed. Or if in some of the articles I've not gone through the detail, if one of the couple have given the
consent and the other refuses,
the sperm or the oocyte, and we freeze in the lab, and on the course one of the member of the couple is deceased, then the procedure cannot continue.
Wow.
Yes. Those can be some of the restrictions that
we can have.
Yes.
So what about a lady who smokes, a lady who has diabetes, anemia?
Yes, I see what you mean. Diabetes, yeah, those are some of the things that can reduce the success rate. Yes.
Okay.
The cigarette, you have cigarette, and in our country, your country, the bleaching process, the women, most of the time they come, they use this medication, hydroquinone, glutathione, corticoids. And when you see her at consultation, you should talk to them. We talk to them to say, okay, you must stop, because they put it either on the screen or injection. It passes through the bloodstream and go to the ovaries. They are very toxic for the ovaries.
Oh, la la.
Women should know that they should stop bleaching. It's not, it doesn't help them. It's toxic for the ovaries, and you should stop that for at least 2 months before we undergo the procedure.
Okay. So now, is IVF painful?
Painful, the process of consultation, ecography is not painful. The pain may come when you do the puncture in the theater, but usually it's under general anesthesia. The puncture is under general anesthesia, and you must give painkillers after the procedure to alleviate the pain.
Okay. Okay. Now, is there anything that could negatively impact the success of IVF? Are there some things that could really cause some troubles?
Yes, the IVF, I've told you the success rate, when you must have done everything, is 35%.
Yeah.
So there are many things that can alter, that can make you not to reach that 35%.
Okay.
Start from the injection. The stimulation is the woman should be on time. If the injection is at 7 p.m., she should do it at 7 p.m. the same time. If it go beyond 2 hours, it should be the same time. The medication use should be of the good provenance. So you have to check there are some medication that have to be kept in the fridge, and if they are not respect the cold chain, then the quality can be altered, and the result of the stimulation ovary may not be good. It also depends on the potential of the patient. At times, the age, if she's more than 42, she run lower chance to be pregnant than young women of 28 or 30 years. And the same for the quality of the semen of the man. It may be poor. The habits, the smoke, diabetes, strain, it can reduce the success rate, and maybe other disease like endometriosis. In a woman, it can reduce the chance even in IVF to take in.
Okay. Yeah. So now, what are the side effects related to IVF?
Side effects related to IVF, normally during the procedure, you may have pains. After the... Is
it chronic? Or just light pain?
No, low abdominal pain. Due to puncture, usually you make many puncture at the ovaries, and after that she may feel pain. When the anesthesia will go down, she may feel pains. She may bleed during the procedure at the theater. That's why we have to we monitor after the puncture to vital signs to make sure they are not bleeding. If there's a bleeding, you should control and maybe try to see if the vessel has not been touched. Therefore, you have to control the hemorrhage. And also after the procedure, one of the side effects may be multiple pregnancy if you have transferred more than 3 embryo. But nowadays, it's advisable not to transfer more than 2. In Europe and Western countries, they do what we call SET, single embryo transfer, to be able to reduce the risks due to multiple pregnancy. 4 or 5 is fetus is linked to increased intrauterine growth retardation, linked to preeclampsia, linked to higher rate of maternal mortality and morbidity. So it's advisable to transfer only 2. Yeah.
Okay. So now, if you're just joining us on the program, then know you're listening to the program You and Your Health aired on Equinoxe Radio Multimedia, and we are talking about medically assisted reproduction known as IVF, which has been adopted in Parliament recently. So now, let's talk about the Parliament. Recently, the bill was adopted. How do you think the defined legislative framework on IVF would ameliorate the practice in Cameroon?
No, I think it's a good law, it's a good news, it's a good framework for the practitioner, the patients too, the couple now in Cameroon to know that we have a framework in which we have to work. And also the practitioner and the patients must work according to that framework. Because for the past 24 years, you imagine, Tommy, the first ever in vitro fertilization born in Cameroon by the team in Douala, that is Dr. Sanjon, Dr. Gretbel, Dr. Onomo, Dr. Bolobert of late, Dr. Christian Pani, Dr. Nicole Akun. Tommy was born through their through them.
What year was that?
1998.
Okay.
She's 24 years now.
Wow. Okay.
Yeah. Since then, many babies have been born, and without any legislation, we have been trying to do oocyte donation, sperm donation, without any framework, and even some cases of surrogacy. But now, the framework permit the specialists to work according to their. We are protected because we only work according to Hippocratic oath. We say primum non nocere. Primum ne pas nuire. You should not. You should do everything not to alter the health of the patient.
Yes.
That was the way we were trying to work. But now you have the framework. You should work according to that. You must respect the age of the couple. You must respect the criteria of the donor. You must be qualified to carry out as gynecologists, as embryologists or pharmacists. In that law, it's 10 chapters, and you have everything. And if you go beyond that framework, be sure that the article that you sanction you. So you have to be careful. Any practitioner has to read that well and be working into that framework.
So advise those who are opting, who would like to opt for IVF, maybe in the days or months ahead. What advice do you have for them?
No, they are welcome. They are welcome. There are centers in 4 private centers in Douala. There's a center in Yaoundé, Crasser, which has been put on by the First Lady and Professor Cassia Crasser. With them, we have the advanced. They have worked a lot for this new law to come out, and they are ready. They can choose the center of their choice, and they are practitioners who are up to the task. They are trained. They have gynecologists. We have embryologists. We have the material, and nowadays you can freeze the embryo at first. At the end, the supernumerary embryo, you have to throw them. They can come easily.
Thank you so much for your time, Doctor. And that's it for this edition of the program You're in Your Health aired on Equinoxe Radio Multimedia. I had as guest Dr. Tingang Kamgang, Jacques Tingang Kamgang, a gynecologist and obstetrician right here in the city of Douala. For presentation, I am Immaculate Fogwe, and I received technical assistance from Raphael Dipanda. Have a lovely day in the company of more programs on Equinoxe Radio and, of course, television.
When I choose my frequency, I settle on the radio with a minute of...
Equinoxe Télévision, au-delà de l'image, nous rendons compte. Du lundi à vendredi sur Equinoxe Télévision.
Voilà un jeune qui vient sur les plateaux et qui fait comprendre à d'autres jeunes comme lui sur le plateau qu'en fait, c'est nous qui sommes gelés du cerveau et que lui, il a raison.